Okay, well, we do have a pretty full agenda, and we only have an hour, so I'm going to go ahead and get started. I think we may still have a few people joining us as I go through my introduction. Good afternoon, and welcome to today's webinar, which is an introduction to environmental assessments and role for public health. My name is Sue Shikazi, and I will be the moderator for today's session. And we also have Robin Kang on the line from OPHA. Thanks to Robin for getting all of our technology set up and for running that in the background. Today's webinar is hosted by the Ontario Public Health Association's Built Environment Workgroup. I'm a member of that group, and so is one of our presenters. Just a quick introduction about OPHA in case you are not aware of who we are. We're a nonpartisan, not-for-profit charity that brings together a broad spectrum of groups and individuals from a variety of sectors that include public health, healthcare, academic, nonprofit, and the private sector. OPHA's mission is to provide leadership on issues that affect the public's health. OPHA offers professional development, like this webinar, information and analysis on issues affecting health, and advocacy and consultation on healthy public policy. Being a member of OPHA is an excellent way to build a network with other like-minded professionals, so if you're not already a member, I encourage you to join. And the website is opha.on.ca. The Built Environment Workgroup is one of several OPHA workgroups that respond to public health issues of provincial interest. One of these issues that we identified through a survey of Ontario public health units was that there is an interest in engaging in the environmental assessment process, specifically related to transportation and roads, but a limited knowledge on how best to do this. So to address this need for knowledge and interest, we've developed a 4-part webinar series, and this is the first one, to begin to build the knowledge and understanding of environmental assessments and how public health can effectively contribute. Today's presenters will speak about why public health should engage in EAs and what is involved in the EA process. The information is Ontario-based, but since similar processes exist in other provinces, much of it is transferable. Today's webinar will be recorded and the presentation made available online. All participants will be muted, but I do invite you to participate, as many of you already have, by using the chat function on your screen. Please feel free to ask questions or add comments, and I will be keeping track of those questions and will pose them to our presenters during the Q&A time after both the presentations. Before we get started with the presentations, we have a few short questions to find out a little bit about who you are. So Robin has posted a couple of polls. The first question is, have you participated in any kind of environmental assessment in the past? So just click in your answer there. So we're seeing majority who have not, but some who have. Okay, so let's go to the next question. What is your current level of knowledge about the environmental assessment process? Just choose one of those options there on your screen. So seeing generally low to moderate knowledge about the EA process. Just good that you're here then. And our third question is, what types of EA consultations do you see being most relevant to your work in public health? Or if you're not in public health, the work that you currently do. So quite a bit related to transportation and roads. If you have other and you want to type into the chat box what those other types of EA consultations are, that would be helpful. I see a few people typing. The food environment and large resource development projects. Yes, that makes sense. Urban design and sprawl. Great. So today's session is sort of an overview, and Lorenzo will go into a little bit more detail about some of the work that the Built Environment Workgroup has done, specifically related to EAs and transportation, but it is helpful to know that there is other topics of interest out there as we plan future webinars. So I'm going to go ahead and introduce our first speaker, who is Lorenzo Mele. Lorenzo is a resource conservation specialist and social marketing practitioner who's been managing sustainable programs and services in the fields of solid waste management, water conservation, and transportation demand management for over 25 years. Today he serves the residents and businesses of the region of Peel Public Health as an advisor, Healthy Design. And in this role, he supports the development and implementation of transit programs, commuter services, land development policies, and cycling and pedestrian facilities to help residents and businesses end their love affair with the private automobile. Lorenzo is a member of the board of ACT Canada, the Sustainable Mobility Network, and the Canadian Urban Transit Association, or CUDA, a member of the OPHA Built Environment Workgroup, and the Ontario Traffic Council Active Transportation Committee. I should also add that he's played a key role in the Built Environment Workgroup's work on the intersection between public health and transportation, and has done a lot of knowledge sharing and presentation on our behalf. So welcome, Lorenzo, and I'll turn it over to you.
Thanks, Sue. Thanks very much for that. I'm coming in loud and clear, I hope?
Yes.
Okay, thank you. So I guess we're going to get my slide deck here.
Yeah.
There we go. Okay. So as Sue mentioned, this is the first webinar in a series, and I think that what's important to note is that this is going to be a foundational session. Hopefully you're left with a lot of questions after this, and that we'll be answering during some subsequent webinars as we go. Okay, so our session objectives this afternoon are really to build awareness and understanding of why public health should be participating in the EA process. What can we contribute? How do we play to our strengths? And then acknowledging that there's some areas of the transportation discipline, for example, that might be challenging for us, needing to network and so on. And then secondly, providing an orientation to the EAs and the EA process, both individual and class. As an outline, I'd like to cover a really brief history of environmental assessment, then moving to making that link between the healthy environment, healthy people. Ultimately, we do have a mandate in the province of Ontario from a public health standpoint to be working on environmental assessments and improving the outcomes of some of the undertakings that are being studied through that process. Some context around transportation planning, environment, and health, and then essentially concluding with some of the results of the two-way street project, public health and transportation working together, which essentially has been the genesis of some of the work that we're doing right now in terms of the webinars and other presentations that we've been making, as Sue mentioned, and then some questions and discussion. So from a history standpoint, I think it's important to acknowledge the Americans' role in this, and you know, really looking at the environment as something that needs to be regulated from a standpoint of maintaining the environment. And so there was an acknowledgement through the 60s that you know, those who reap the rewards of modern technology must also pay the industrial price, or pay the price of industrial pollution. And a lot of the foundational work that was done through the 60s and 70s we're still left with today, of course. And then in 1969, you know, the first National Environmental Policy Act. And I think what's important to acknowledge here in all of this work is that there's this harmony between humans and their environment, promoting efforts which will prevent or eliminate damage to the environment and the biosphere. So it's that real link to stimulate the health and welfare of humans that's important to acknowledge. Looking at it in an Ontario context, in 1975, Premier Davis at the time, these are the statements that were forwarded through with the Environmental Assessment Act becoming law. The betterment of people, whole and part of Ontario, and then George Kerr was our first politician in Canada to hold the environment portfolio. So that connection between the environment, natural systems, and humans living in them, I think, is key to this. So we do a lot of work in environmental assessments at looking at environmental impacts related to, for example, endangered species. In this case, the red-side dace. It's an indicator species. It is endangered, and so there's a lot of care that goes into, for example, environmental assessments in studying how best to protect the environment of this particular endangered species. You could also say that people walking in our communities as a result of the way we've designed and built them, they become an indicator species too, and something as simple as walking to school becomes more and more challenging as time goes on. And so framing this notion of an environmental impact assessment under that human sort of impact lens becomes key to all of this, and let's take a closer look at some of it. So when we're thinking about the mandate of, especially in Ontario, public health units, we're definitely mandated by the province to work with municipalities to create the built environments that support health. The recently released Ontario Public Health Standards, I think, go even further. The protocols and guidelines, some of them are listed here, I think create for us a really important policy foundation upon which to build greater assessment of health impacts of various undertakings. The other thing to note on this is that both at the federal and provincial levels in Ontario, there have been assessments carried out of the environmental assessment regulations, and one of the things that has come out in both of those, the Auditor General's work in 2016 and a review of the federal environmental assessment regulation, was that we need to go further on addressing health impacts in both of those processes. So I think what I'm suggesting here and what we're suggesting is that we're on really important and firm policy ground to keep moving on this front. So shifting gears into the context a little bit, and it was great to see that many people are participating in EAs, and especially the transportation EAs. A lot of what I'll be focusing on, because of my own personal practice here at the Region of Peel, are the transportation and land use planning type planning exercises, and how health can be involved in those. So there's what we're acknowledging is that all communities are moving towards this sustainable development. I mean, there's an acknowledgement of that as communities grow and change through demographics and so on, that transportation land use planning increases, and so there's this potential for public health to become more involved, and with sectors that are very different from our own in public health to influence change. So taking a closer look, we've seen these images of the suburban type sprawl. What's interesting to note about this is that people have been commenting on this type of development for many, many decades, but the reality is that people still want to live in these types of places. And so I think we have a duty and obligation to understand how to make these as health supporting as we can. When we look at some of the designs, we see wide roads, we see disconnected blocks. In this case, it's a transit stop that's located in an awkward position in relation to the other side of the road. How do people get across? A lot of times this creates a lot of risky type situations. We're building communities where there's lots of latent demand for walking. Unfortunately, in this particular case, which is a very new community, they didn't build the sidewalks in. And so when we're looking at healthy design, These are some of the things that we come up against from a public health standpoint, and so we struggle on how to get through them. And this is, the classic image of the sidewalk just ending at the property line, and then people still having to navigate through the area. And then this is classic as well, wanting our cake and eat it too, in terms of, encouraging people to ride their bicycles to these locations, but also creating ample and good opportunities for people to drive and not even having to get out of their vehicles. So how do you intervene in all of this? And I think what we've concluded is that the built environment, anything that's physical in the environment that's created by humans, the land use patterns, the transportation systems, and all of those urban design characteristics, I think that's what we're talking about when we're talking about this built environment, the physical environment. And what we're acknowledging now is this growing body of evidence that supports this relationship between community design and public health. So we're trying to identify, what are the health supportive type of community design. And then when we look at the work that we do, concentrating on research and policy and the evidence to move this forward, I think become key. In terms of those transportation and health pathways, these are the obvious suspects here, CO2, air quality, noise, risk of collision, injury, community severance, cohesion. That's one that not a lot of people study, especially when they're dealing with transportation EAs, but I think it really impacts on quality of life, and there's some good research on how to assess that type of thing in environmental assessments. And then climate change. There's a guideline within the Ontario Public Health Standards specific to climate change, and I think that what we're talking about in terms of these transportation and health pathways, I think climate change is becoming increasingly important to understand, not only from a mitigation standpoint, but more importantly from a resiliency standpoint. Access and accessibility, social health equity, and there are definitely others as well that we need to be thinking about. We also know that from a chronic disease standpoint, the situation in Canada isn't getting better, and something like the lack of physical activity, that inactivity that people have in their lives, is contributing to significant chronic diseases, and the top 4 as listed in this particular slide. We also know that there's prevention power in active travel, walking, and cycling, and you can see the benefits here. Our former medical officer of health, Dr. Eileen Davila, used to say that, if there were a pill that gave us this kind of benefit, it would be useful to invest in the pharmaceutical company that was coming up with that particular drug. But it can't be understated that building this type of behavior, this type of activity into people's lives through the built environment becomes what we need to focus on. Okay, so let's shift gears and take a closer look at the two-way street, public health and transportation working together. Some of you on the line may have participated in the survey work, but let me get into the entire project. So the first step in this was a consultative approach, using in-depth, semi-structured interviews with transportation professionals. So those key informant interviews, and that part of the project became really sort of key to moving to the next stages, which some of the outcomes we're experiencing today in this webinar. So looking at the outcomes from this, just at a really high level, and I'll also suggest that the reports, the detailed reports, are available on the OPHA website. So when put to transportation professionals, and these are people that were either with associations or planners, transportation engineers, and so on, these are the types of challenges that they saw at improving the active transportation, for example. So they're listed there. I think that, if you look at something like number 2, exclusive and predictable funding, everybody keys in on funding. What I would suggest on that, it's really a matter of shifting funding as opposed to maybe new sources of funding. and that's something that comes out in the environmental assessment process. You can see how if you start shifting your priorities, the funding pool actually is enough to deliver on some of your aspirations. And so it's just a question of priorities. Definitely number 5, the information gaps about active transportation, the value and design. I think this is probably a key role for public health professionals to be able to communicate that value. So I'll leave that list for now. And then when the question, how can public health help, we can see that, additional policy and funding support becomes key. So I think, again, on the funding, it becomes making the case to shift the funding from traditional transportation undertakings into ones that are more health promoting. Public education outreach efforts, I think that there's an opportunity, and especially at a province-wide level, to really, create that business case and put it out in an amplified way through potentially through the public health associations across the province and the public health units. And then finally, this notion of participating in scenarios such as environmental assessment studies. So you can see that the work has been leading us to where we are today. And then in 2017, we had an opportunity to workshop this topic with public health professionals. And without getting into a great amount of detail, one of the word clouds that was produced from that exercise, what can public health contribute? You can see that we really need to focus on what we're good at, which is building the evidence case based on research and then forming it into policy, and then ultimately focusing on the health benefits of the work that we do. Second part of this work around two-way street was the EA survey, public health units. Really the objective there was to understand our current level of engagement. That methodology was an online survey over 4 to 6 weeks, and it yielded some pretty important insights, some of which we're experiencing right now, and I'll share a little bit as well now. So in terms of the staff involved in public or in environmental assessments, I think that it doesn't come as a surprise that environmental health, the managers, the environmental health specialists and public health inspectors are the ones, especially in smaller health units, that are directly involved in this work. So I think that there's some important insights coming out of this in terms of training and knowledge transfer and so on that I think we need to pay attention to. Some of the barriers to getting involved, I mean, this is the classic one. We do not get notification from our local municipalities. That's something that could easily be remedied. Again, it requires a relationship, a dialogue with the authorities managing the environmental assessments, but it's something that could be easily addressed. Some of the topic areas that came out when we asked the questions, what are you concentrating on? Air quality is definitely a dominant one. A lot of the EAs require air quality studies to be carried out. And then you can see some of the other ones related to water and soil climate change impacts. So the usual sort of suspects when it comes to transportation EAs, but now we're also thinking about community safety and injury prevention. And then finally, almost 100% of the public health units that participate in the survey would like to be more engaged. Professional development was something that was outlined, online resources, and assessment tools. So there's more to come on this. That's definitely the message that I have. And some of you in your own practices, and at some point we may circle back again and try to better understand some of the tools that are being used in doing this work. And then in closing, public health's role with transportation, it's really to key in on the evidence-informed tools to assess the health impacts. It's not enough anymore to just say we want the community to be more walkable. We want the corridor that you're designing to be more walkable or bicycle friendly. What does that mean? The engineers are dealing with these the design in mathematical language, and we're talking about, feelings of comfort and safety. So I think we have a duty and obligation to really hone in our practice with some better evidence-informed tools to assess the health impacts. And then ultimately we're, influencing these local policies, including land use, transportation, planning, design. And then this notion of getting local programs together and stakeholders, I think for public health is something that we can do. And advocacy for certain is a shared provincial and local sort of responsibility. And then in closing, really looking at what the opportunities are for transportation professionals. I know this isn't a transportation group on the line, but we have been presenting this type of presentation at transportation conferences and different traffic engineering workshops and so on. And so there's an understanding now that public health agencies can help with these assessment tools. It can actually improve the design of some of the projects that are being undertaken, and then maximizing this evidence-informed approaches. I think that's what we have to contribute to this from a health standpoint, is really relying on the rigor of the evidence and the research that we do to improve design so that they're health promoting and so on. And then finally, helping build professional capacity. So that's why we chose the term two-way street. Really, I think that, the transportation planning, the transportation and traffic engineering communities are supportive. And I think that, as we move forward, we've got fertile ground to help influence and, change design so that it's health promoting, so that the healthy choice is the easy choice. And with that, I'm going to say thank you, and there's a few links to these different papers and so on from the Ontario Public Health Association Built Environment Workgroup.
Well, thank you so much, Lorenzo, and I'm glad that you wrapped up that last slide with the word opportunity, because I agree. I think throughout the research that the Built Environment Workgroup has done, it's come up as, there being opportunity for, and new and emerging opportunity for public health professionals to get more engaged with people who work in the design and the building of our communities, and in particular of our transportation system. So really, really great positive word to finish up your presentation.
Thank you.
Just a reminder that if you have any questions for our presenters, you can put them in the chat box, and we'll take some questions at the end. But first, before we get to that, we have another presentation. Our next presenter is Greg Jenish. Greg is a Senior Program Support Coordinator with the Ministry of the Environment, Conservation and Parks. In this capacity, he has developed guidance for the environmental assessment and approval programs for the incorporation of climate change considerations in project planning and for stormwater facilities in support of Great Lakes target approval. Prior to joining the ministry, Greg held positions in the private, not-for-profit, and public sectors. He holds an honors Bachelor of Environmental Studies from the University of Waterloo. So welcome, Greg.
Okay, good afternoon, everyone. Thanks, Sue, and a special thanks to the OPHA for the opportunity to present on environmental assessment practice in Ontario. As introduced, my name is Greg Jenish. I'm with the Client Services and Permissions Branch of the Ministry of the Environment, Conservation and Parks. Lengthy title to deliver, but my branch provides support to the environmental assessment and approvals programs ministry. So diving right in, what is the purpose of environmental legislation in Ontario? It is to provide for the protection, conservation, wise management of Ontario's environment. The definition of environment in the Act is very broad. This is an important point. And it includes the social, economic, cultural, built, and natural environments and the interrelationships between them. And this is one of the reasons that those familiar with environmental studies might find that they are very comprehensive compared to perhaps other types of studies for, say, our approvals like permits to take water or environmental compliance approvals. The environmental assessment process complements and supports other processes, approvals and permits, as I was mentioning. It ensures that the potential environmental effects are identified, evaluated, appropriate mitigation measures identified, and that interested and affected parties are consulted and opportunities to participate are provided. And I'll speak quite a bit about participation as we move through toward the end. But first, why do we have environmental assessment in the first place? And as noted by Lorenzo in his presentation, in the early 1970s, public opinion called for better environmental planning to respond to growing environmental challenges and for alternatives to the then existing practices. So, for example, a shift away from pollution abatement or, end-of-pipe control to pollution prevention. And the legislation at the time, though we were sort of forerunners in Canada and North America in many ways, the EPA and the OWRA, that's the Environmental Protection Act, Ontario Water Resources Act, often focused on emissions to the environment, were very technical. And EAA would be bringing about a sort of new, more comprehensive, holistic environmental planning process. That's what was being sought. So in 1973, my ministry produced a green paper, and by 1976, the Environmental Assessment Act was enacted. So in its concisest form, what is an EA? It's a formal planning and assessment process used to identify and evaluate potential effects of a project before any decisions are made to proceed with the project. EA is a proponent-driven process, and this is important as since the late 1990s, amendments to the Act made the process more proponent-driven and relied less on sort of hearings. If people seem to have conjure up the idea that many environmental assessments go before hearing panels and hearing boards, that was the process previous to 1998, but the Act was amended to change it in a number of ways, and I'll be sort of presenting that as I move through it. And I'd like to emphasize, though, these processes that I describe may seem very formal. Participants shouldn't feel intimidated in, participating. Proponents will, at public open houses and public meetings, attempt to make the ability to contribute, as agreeable as possible. So, we welcome the public's role in environmental assessment. And so what is a proponent required to do that's undertaking the EA? State the problem to solve or the opportunity to realize. They are to consider a range of alternatives, assess the potential impacts, consult with the public, propose monitoring and mitigation, pick a preferred alternative, and document the work. These steps combined, you could say, in essence, the proponent's duty is to formulate and publicly state a defensible rationale for the project. And all these steps are covered in greater detail in our codes of practice. I'll have a slide at the end that points in that direction if you're interested in learning more of that. Oops, I forgot to bring the graphics up. Who are the people who have to do EA? Well, the Act originally was confined to the public sector and identified a number of ministries and agencies for which environmental assessments would need to be undertaken for their projects. So, for example, in forestry projects, the Ministry of Natural Resources and Forestry may carry out EAs, can and does do, and as well for transportation projects, the Ministry of Transportation, also Go Transit, and other public agencies and ministries. But it can now also apply to private sector proponents in a number of ways, but one of the principal ways is that any private firm proposing a project type identified in the regulations for a waste EA, a transit EA, or an electricity EA, those proponents will need to carry out an environmental assessment. So it's become broader than it was in its original form. These are the four principal processes under the Act. So for individual EAs, obviously the highest level of assessment, it's going to apply to very complex projects with potentially significant environmental effects. the streamlined EA processes, which I think the participants today may be very much interested in, maybe have even participated in. These are the standardized processes for certain defined classes of projects which have, we say, known environmental effects, and for which the effects, there is mitigation. So there's far less unknowns, far more certainty. With designation requests and declaration orders, I won't dwell on those. They allow for a proponent or a project to have the project made subject in whole or in part or not at all to the Environmental Assessment Act if they are not captured under the Act at the time of their proposal. So the next few slides will deal with the individual environmental assessment process. It has two main components on the part of the proponent, public-facing, the terms of reference stage and the EA study stage. The terms of reference stage you can think of as a work plan. So it'll set out things like the range of alternatives to be examined during the EA, the studies to be done during the EA, the potential effects, etc. Consultation needs to occur on the terms of reference, and it must be approved by the minister in order to proceed to the full EA stage, the part where the studies and the consultation take place. So if and when approved, an individual EA will undertake a consultation process detailing environmental effects. It'll detail the performance assessment and decision-making processes associated with the project. When that study is complete and submitted to the ministry, there's a public review period for the environmental assessment, followed by the government review team. So it's a multi-part team that looks at all the aspects of the project from all different types of standards, for my ministry, water and air, but from transportation, safety, and this is the part where the ministry reaches out to parties outside the provincial government. It includes the federal government, the municipalities, possibly the municipality and or conservation authority in the location of the project, and including we contact the medical officer of health and the public health unit that could be affected by the undertaking if it proceeds to implementation. And this is, that contact is made only during the individual EA process. The Class EA and streamlined processes are a bit different, so I'll just make that note. And at the completion of the review of the EA report, the review of the ministry's review of the EA, the decision is left with the minister as to whether to proceed or proceed with conditions, need for referral, etc. Individual EAs are fewer in number than the Class EAs, so this is sort of the most comprehensive process under the Environmental Assessment Act. So this slide details, again, the points of public consultation in the terms of reference stage, in the EA study stage, and since 1998, the amendments to the Act ensures that public consultation opportunities are front-end loaded all during the process to ensure that issues can be resolved early and ideally not left till sort of the 11th hour, necessitating sort of a complete rethink of a project when there's already been 2 or 3 years invested in studies and processes and moving towards approval. Individual EAs may conclude with a notice of approval, those that are approved. Approvals and orders may include terms and conditions outlining how the proponents proceed with the undertaking. And if you are further interested in exactly what type of projects might go through an individual EA, we maintain a listing, and you can see it there in the bottom left on our website, of the types of projects, large waste management projects, large transportation, hydroelectric, or energy related are typical sort of project types of individual EAs. Now, a quick overview. This is the streamlined EA process. This is going to capture two types of EA processes, the Class EAs and those created by regulation. And these processes are the most numerous, most frequent, so they could be of most interest. They'll often have notices in the paper or notices sent to municipalities. They might come to a unit if you're in a unit. So just quickly, the generic steps. The proponent publishes a notice of commencement. They undertake the required project planning. They provide or report to the public the draft findings of the EA along the way, sometimes through public information, open houses, etc. People can call for the report. Report's often available in the library and municipality and other locations here at the ministry. And then finally, when the report is ready, that's the proponent's decision, it is the proponent issues a notice of the completion of study process. And what that initiates is a 30 or 60 days sort of report inspection period. The public can look at it. If they feel, if the participants feel the issues remain unresolved, if necessary, they can request that what's called a Part 2 order or elevation request. It's colloquially referred to as a bump-up request at times. That would be to have the study undertaken by, in its fullest form, the comprehensive individual environmental assessment process. And if no requests are received at this point in time, after that 30 or 60 day period, the project can proceed to implementation. So that's the arrows going to the left. The arrows going to the right detail the process if there's Part 2 order requests. If you ask me, approximately how many go in which direction, probably 70 to 80% of streamlined EAs do not receive a request for a higher level of study and move towards proceeding on the left. Maybe 20, 25, 30% proceed in the other direction. Starting with Class EAs, one of the groups of the streamlined EAs, they are set out in what's often referred to as a Class EA or parent document. Sets out a standard planning process for a class or group of projects. There are 11 of these Class EAs approved for use in Ontario. They're created by proponents like the Municipal Engineers Association, Go Transit, Hydro One, and I have a list at the end of the slide deck if you're interested in a particular process. Each of these will have projects arranged according to environmental risk in groups, category schedules, and all of the projects in these approved Class EA documents, because they've received approval from the Lieutenant Governor and Council, effectively making it the status of a regulation, they're deemed to be pre-approved, you could say, but provided the proponent follows the process set out in the document. And if it's found to be, if somebody seems to find that the proponent did not, that's where the Part 2 order provision ensures that the process is followed, because it's, I think any proponent will mention they prefer not to receive a Part 2 order project. It could delay, or create uncertainty for the project moving forward until all issues are resolved. And then finally, I'll reiterate the Class EAs are for routine projects, predictable, well-known. Some of them could be as minor as replacement of water distribution or electricity lines, sometimes even sidewalk refurbishment, and these are very streamlined processes for those types of projects at one end. At the other end, in the Class EA, it could go up to refurbishment or possibly replacement of a wastewater treatment plant, and the process outlined in that Class EA for that will be actually quite comprehensive and nearly mirror an individual EA. So it's all of the assessment processes within a Class EA are created along a sort of gradient of comprehensiveness. The other three processes for waste projects, electricity and transit, these are created by regulation under the Act. They allow for both private and public sector proponents. They too will have minimal requirements, moving to, an environmental screening process without a minister's decision, or for the biggest class, the biggest project in, or project class in that screening process, it has been pre-designated will require an individual EA. So, a major new landfill or waste treatment site could potentially require an individual EA under the OREG 107 waste project EA process. I'm going to start moving along to get to things that I hope are more interesting and relevant to the group now that I've laid out sort of the lay of the land with environmental assessment. Again, emphasizing mandatory public consultation, notices, proponents are required to issue notices so that you are aware that the project, the process is underway and you can get involved. I mentioned the Part 2 order request. That's what sort of backstops the Class EA processes if a member of the public feels that the project was not studied sufficiently or there were gaps in the process. If a request is received, the ministry here will initiate a review. We'll pass our findings of the review to the minister and a decision will be made. Minister or director in some cases can deny the request and impose conditions, grant the request, or refer it to a mediation or tribunal. If the decision is to deny, the proponent may proceed with the project. If the decision is to grant the request, the proponent may not be able to proceed without preparing an individual EA for that project. Now, if you are interested in participating or getting more involved, I think these slides will be of assistance. They're drawn from our codes of practice, and they just spell out some things that would really help. Or if you get calls from people asking how might I participate in an EA process, or I got this notice in the mail, I'd like to say something or do something about it. If you're keenly interested, get in touch early, get comments in early, although you may need to see some of the documentation, attend the public open houses first, talk to the proponent. You can CC the regional EA coordinator or the ministry if necessary. You can call us to find out about participating and document your participation, particularly, and your concern, particularly if, you might be concerned that down the road, as it gets closer to the completion of the study process, you don't know whether your concerns are going to be adequately addressed. All these kind of due diligence steps, you could say, again, participate in the consultation opportunities, share information about your concerns with the local community. If you have a hiking trail, a canoeing route, or something that may not be very well known to the proponent, sharing information like that could lead to adaptations of the project. The more anyone demonstrates participation, this will indicate that the participant has acted in a good faith, meaningful manner, and is not solely attempting to blockade or the process or stymie the process from moving forward. On occasion, we do receive Part 2 order requests at the end of a project, and the person has not been heard, has not been known to the proponent or to the ministry or virtually anyone involved to date, and expresses their concerns at the very end, and it makes it extremely difficult to, you can imagine trying to weigh in how valid is this concern. There were open houses, the person didn't participate, there were no letters, there were no contacts to the proponent. I think the more the public can get involved, the more we might see movement towards the kind of planning, that has been described, by Lorenzo in the previous presentation. I'll just make a note here about the guidance available if you need assistance through our website. We have guidance on the processes and how to participate there. And finally, I think, oh, sorry, before I get to that, no, okay. I was just going to say, I have a list of the various Class EA processes and streamlined EA processes. If that's needed, I can send those forward, but you can also find them on our website, and details are posted about each of those. So I'll just back up and stop at www.ontario.ca environmental assessment. And I'll cap it off there, Sue. And
All right.
Yeah.
Thank you, Greg.
You're welcome.
It's clear that there's lots of opportunity for engagement in the environmental assessment process, whether it's a large-scale individual one or a more locally scaled Class EA. So that's really helpful to know. And it's also great that you've provided these references because it's, I think, a lot of information for folks to absorb,
Sure.
but it's nice to know that there's tools available from the ministry to assist. So it's a really helpful introduction for people. Thank you so much for that. All right, we have a little bit of time for some questions. So there are a few in the chat box. So the first one comes from Charlotte, and I think this will be directed to you, Greg. She asks, although the legislation says before decision, so this was from one of your early slides, I find that's rarely the case. Can you comment? So I think this has to do with, there's a consultation process, but is the project in fact already determined? How much value is the consultation, that sort of thing?
Well, I guess project planning needs to occur to the point of being sufficient that you characterize something going forward, beyond, we'll have a right of way, not specific to whether that's for boats, trains, planes, or automobiles. It does get detailed often to the nature of a roadway they're proposing, or it could be a transitway or an electricity line. So in the Class EAs, there's a little more to the point of just starting with the problem or the opportunity, which somewhat confines the scope of what can be sort of considered as alternatives, a little more so than would be in the case of an individual EA. But there's certainly no decision made as to proceeding with the project, and no ability for that proponent to seek any subsequent permits or approvals needed to implement the project. So it still is very much in the proposal stage when the Class EA process is operating.
So that sort of speaks to the need for those of us in public health who want to comment to really have our ear to the ground about what kinds of EAs are underway so that we can engage at the appropriate time.
Yeah, I think the greater the chorus or choir, promoting good, sensible, livable communities, if it is, or that direction, the stronger the better it'll be. You can probably realize that in our role here, as administrators of the environmental assessment program, we have to take quite a neutral position on any given proposal. We'd either promote it, advocate it, or we'd either oppose it. We need to ensure that the requirements of the Act are met as it moves through. But folks in the community and in certain walks of life, public health and local environmental departments and everything can definitely weigh in. And
okay, great. So this next question, Lorenzo, maybe I'll ask you to respond to this one. Would there be times that it would be advantageous for MOHs or health units to participate in an EA separate from the municipality?
Well, I think that all of the public health units across the province need to understand the relationship that they have, obviously, with the local jurisdiction that's advancing whatever undertaking it might be. So I think the public health units are autonomous enough that they should be able to participate as a stakeholder. I mean, and that's kind of the conclusion that we're coming to, and I think Greg alluded to this as well, is that, you know, we've got public health units that want to participate in the environmental assessment process, but there's a certain amount of trepidation on how to go about doing that. And so there's another question on the lines, is it mandatory for notification of EAs to public health units? And I mean, I think that the answer to that is no, it isn't. But it depends on the undertaking. So sometimes you'll get notifications, sometimes you won't. So yeah, I think that what's key is that the public health unit understands the undertaking, whatever it might be, and that they scope the assessment that they're going to do as it relates to health specific to that undertaking. So I think that that's the message that's going to come out in subsequent webinars as part of this series, is that, you know, these tools that we're alluding to allow us to, in a more, you know, intelligent, rigorous way, comment on these environmental assessments, you know, from a really informed position and really showcasing what that health evidence might be as it relates to the project. So the answer is yes. I mean, definitely they can be independent from municipality. Their assessment should be independent as well, but it should follow the process, of course.
Right. I might just add to that, I have seen very pithy, meaningful information come forward in, you know, the form of comments on a proposal from public health units. So I, encourage continued participation. It often very much crystallizes, you know, issues around, you know, boiled water advisories or other matters, you know, locally that we wouldn't have as much detail on, because occasionally a member of the public, very well-intentioned, often doesn't have that technical background or detail. They might say, we have problems with, you know, air, water, and garbage in our community. You know, we don't need this proposal. Well, those three words don't really tell me a lot or anyone a lot, but when you get that really detailed information, you know, to the point information coming in, it really helps understand, you know, the issue in locally.
Great. We have time for one more question. So, Greg, this one's for you. How does the ministry ensure that they adequately engage with Indigenous?
Whoops, did something drop off? Adequately ensure.
Fine.
Oh, sorry, I only got to, how does the ministry adequately ensure?
Engage with Indigenous communities.
Oh, we do a lot. It's done through, we have obviously a duty to consult on various programs, policies, and even right down to permits and sometimes amendments to what we call environmental compliance approvals. These were formerly called certificates of approval, people shorthand C of A. There are many steps and measures. It kind of, that would be almost perhaps a bit of a presentation on its own, but I will mention that sometimes what we have in the case of EA is we can transfer the obligation to individual proponents, and proponents thereby and often even provide the proponent with local contacts and lists, and the proponent makes the outreach and will follow up to see the, you know, extent to what has occurred in the consultation. So there are various mechanisms, but yes, Indigenous duty to consult is top of mind in just about every approval and EA process.
All right, thanks. All right, well, we're out of time for today's webinar. I'd like to thank all of you for joining us, and many thanks to Lorenzo and Greg for your informative presentations, and for to Robin at OPHA for all of your technical support. Just a reminder, if you want to join OPHA, you can visit the website at opha.on.ca. Keep an eye out for the next webinar in this series, which, as Lorenzo alluded to, will speak in a little bit more detail about what and how public health can more specifically engage and what kinds of comments can be provided. The date for that will be late November, not still to be confirmed, but OPHA will be sending out an email about that, so you can watch for that in your inbox. The webinar will be available online, and a link will be sent to you early next week, but if you want to review right away, you can download the presentation from the Adobe screen, which is on the right-hand side of your screen. Thanks again for joining us, and enjoy the rest of your day.
Thank you.
Thanks.